Hello, and how are you? In this presentation, we are going to acquaint ourselves with the subject of public mental health. It is basically an introduction of how mental health can be integrated in public health, and we are going to define mental health and other related terms. We are going to explore the terms that influence mental health, the biological, psychological, social, and environmental factors. We are also going to look at the strategies of prevention, promotion, and intervention in terms of mental health. We are going to examine some approaches to mental health care delivery and some of the challenges that we face in public mental health. All right, so mental health encompasses that emotional, psychological, and social well being that is characterized by the ability to manage your emotions of sadness, happiness, cope with stress and function effectively in your daily life. So it basically looks at how you can control emotions, how you can cope with distressing events, and then function in the way you are expected to. So when you are mentally ill, it means that you have a clinically diagnosable condition that affects thinking, emotions, or behavior and results in impairment of daily functioning. And examples here include depression or that feeling of lawlessness. You do not take um, pleasure in the activities that used to make you happy. Anxiety, and then schizophrenia, which is characterized by feelings of delusion and hallucinations. And in this case, someone might have that false belief that maybe I'm the president, and yet they are not. And perhaps they could perceive things that other normal people are not perceiving, like seeing rain when there is actually sunshine. So there will be schizophrenic, or they'll be having that condition called schizophrenia. Then we have mental well-being, which is a dynamic state of optimal mental health that is characterized by that feeling of contentment, satisfaction, and the ability to enjoy life and reach one's full potential. So if you can enjoy life, you can feel satisfied, then we are going to say that you are having that mental well-being. So then another key term is mental disorder, and this is a broader term than just mental illness, and it encompasses mental illness itself, where we looked at those situations of depression, anxiety, and schizophrenia, which can be acute in nature or they occur in a short time. But when we look at a mental disorder, it could be permanent or prolonged in nature. It could be chronic, and it includes conditions that affect mental functioning, including developmental disorders such as perhaps mental retardation, speech disturbance, things like personality disorders that we are going to look at in subsequent sessions, like the borderline personality disorder, obsessive compulsive disorder, paranoid personality disorders. There are a lot of personality disorders that we are going to discover in our subsequent sessions. And then substance use disorders, things like alcoholism, smoking, and other injectable drugs that can be used by people, and they also form these mental disorders. Then, when we look at this mental health, we are going to realize that it is more of a continuum, and that is to say that individuals can experience multiple dimensions of mental health uh, at different points of their lives. So you might be well now, but in the future or in the near future, you're ill. So it doesn't mean that if you're well now, then in the future you will not be mentally ill. So there is always that continuum that we exist in, and we need to be to be cautious of the impending factors that can lead to mental illnesses, and it's only then that we can put in place mitigation measures so as not to fall into that trap of mental illness. So we also need to focus on the strengths. While mental illness requires diagnosis and treatment, mental health also involves recognizing and fostering individual strength and coping mechanisms. When we focus on improving the way someone can cope with distressing events, then we can really be assured of having a better mental health outcome. Then it should also be a holistic approach that addresses both mental health and mental illness so as to achieve overall well being. So, then if we want to cultivate a foundation of resilience, then we need to know the factors that influence mental well being, and these can be biological, psychological, and social in nature. Then we also have the fact that access to social support can also influence mental well-being. The people around you, is it the family, the friends, the society around you, can they buffer these mental illnesses in case you suffer from any of them? Then those healthy lifestyle choices. What choices are you making? Are you this kind of person who engages in alcoholism or not? Are you this kind of person who engages in drug abuse or not? So the lifestyle choices that we make can also determine whether we suffer from these mental illnesses or not. Then we have healthy relationships as one of the practices for better mental well-being, and basically this contributes to a better social support system. Then physical activity will go a long way in making sure that you have a better brain activity and brain health, and this can help you to mitigate or prevent these mental health illnesses. Then we have meaningful activities. It can also they can include even physical activity itself, include reading meaningful literature, socializing with the right people. So those meaningful activities, instead of you engaging in betting, drug abuse, they could be better for your mental health, those meaningful activities. Then mindfulness and stress management can also be important in this case. And basically here we are looking at being in control of your thinking. Are you cautious of the thoughts that you have? Okay, so practicing mindfulness through being in a place where you are alone and meditating or listening to your breathing at that point, making sure you do not have any disruptions, then in that case you could end up managing stress and having a better mental health outcome. So we said there are a couple of factors that determine our mental health outcomes, and one of them is the biological factors. And when we talk about biology, we are looking at things like genetics or the genes that you have, then the brain chemistry, where we look at the neurotransmitters, and then the physical health. So when we look at the genes, we are saying that in this case, if you belong to a family where one of the people that came before you or in the past generations there was a mental illness in one of them, then you could be at risk or increased risk of developing a mental health disorder. This is when we talk about genes. Okay, Doesn't guarantee that you're going to develop the same, but you are at risk. So if you notice that there is that history, then you have to put in mitigation measures. You have to be wary of something that could happen, and then how do you manage it? And we have already highlighted on the strategies that you can use to mitigate some of those mental illnesses. Then the brain chemistry, we look at the neurotransmitters that play a crucial role in regulating our mood, our emotions, and behavior. Uh, Neurotransmitters like a serotonin for happiness. So if you have maybe an imbalance or it is low in your body, then you could end up having those feelings of depression, you know. So we also have other neurotransmitters such as dopamine, which is important in making you happy whenever you do something that is of an achievement basis. So if you achieve a goal, ideally you're supposed to feel happy. If you take part in an activity that brings you pleasure, you are supposed to be happy. But if you lack this dopamine, or if for some reason you do not respond to this dopamine being released, then you might end up having those mental health disorders. Then we have physical health, and in this case, we look at things like chronic illnesses, sleeping disturbances, and substance use, which can impact mental well-being. So if you do not sleep well, then your brain cannot work well and could be at a greater risk of developing mental illnesses. If you have chronic illnesses like HIV or AIDS, you could also, if it is not well managed, then you could end up having these mental health illnesses. But there are also conditions which are not chronic. For example, malaria. If malaria is not treated well, then it could result into that advanced malaria called cerebral malaria, which can damage your brain and lead to mental health illnesses. Then psychologically, we have the psychological factors that can be important in influencing mental well-being. We have the thoughts and beliefs. How are you thinking? Are you a person who dwells on the negative? If you're faced with a challenge, do you focus on the positive side or the negative side? So if you focus on the positive side and you believe that you can weave through this challenge, then you can be at a higher risk. You can be at a greater chance of not suffering from these mental illnesses. But if you have this thought process of you dwelling on the negative, thinking about how you have lost, how you have failed, you know, then you are at risk of being depressed and suffering other mental illnesses. Then the personality traits. Which personality do you possess? Okay, there are some personalities that predispose people or make them more vulnerable to suffering from these mental health issues, and we are going to look at the details of these personalities in our subsequent sessions. So there are those personalities. For example, if you have an antisocial personality, you do not relate easily with the people around you. Okay, so meaning that if you suffer from a distressing situation, or if you have something that is stressing you, you do not have someone to talk to, you do not trust people around you, you cannot effectively communicate to the people around you about something that is bothering you. So that means that it will put you in the corner, it will squeeze you, and it will make you end up getting these mental illnesses. Then how effective are you at coping to these stressing situations, or these situations that bring about mental disorders? Are you good at managing stress, your emotions, or the challenges that we face, or not? So if you are good, or if you are empowered to manage them, then you can survive these mental illnesses. But if you are not, then there will be a problem. Then socially, We can look at the relationships that you have with your family, friends, and social networks. We can look at the social support that can be availed. Do you feel supported by your family or friends? Do you feel cared for? So that you sometimes you want to open up, but you do not have that person to open to. Okay, you want to, but there is no social support system. So socially, for us to have a better mental health outcome, we need that social support in which we feel cared for, in which we feel supported by our family, by our friends, so as to buffer off, so as to prevent the adverse effects of these mental illnesses. Then we have socio-economic factors, poverty, discrimination, social isolation, all can impede your mental well-being and cause mental illnesses. So we have looked at the biological factors, we have looked at the psychological factors, the social factors, and then now we can also delve into the environmental factors that can influence our mental well-being. So in the environmental factors, we focus on the social economics around us. Okay, are we living in poverty where we cannot access our basic needs? Are we living in unemployment? Yes, you have finished school, but you do not have a job yet. Do you lack access to the resources that you would want? Okay, so in if the environment is not favorable, if you are living in poverty, you are not having a job, and even when you try, and you also do not have those coping mechanisms, then you're going to suffer from these mental illnesses ultimately, okay? Or you're going to have a higher risk of suffering from the same. Then we have cultural influences. What are the norms? What are the expectations out there in the society that that you are living in? How do you perceive seeking for help? Okay, because there are some societies where if someone is mentally ill, then they associate that with a curse. Okay, they think that maybe they have been bewitched by perhaps their relatives or something. Okay, then there are those societies where if you feel depressed and maybe you are a man, you are not expected to go to the hospital, you're not expected to seek for help because that will make you weak. That is according to that society. So if you belong to such a society, you are a man, you are expected to be strong even when you feel depressed, then you could end up with the adverse effects of this depression. It could lead to a bigger mental illness or mental disorder. So the environment in this case plays a very big um, plays a very big role in determining our mental health outcome. Then the trauma and adversity, if you're living in an environment which is characterized by civil wars here and then, if you're living, if in the environment you've lost a loved one, if there has been an accident that claimed the lives of many people, if there is a disease that took a lot of lives and the people that you cared about, like the most recent one being COVID-19. So those traumatic events that can cause a lot of harm to our mental health. Okay, so we have now really acquainted ourselves with what mental health means, with what mental well-being means, with what mental illnesses mean, and also what could lead to the same. Okay, so now we need to know, why should we measure mental health? Is it important to measure mental health, or we can just leave it all together? Well, it is very important to measure mental health because if we measure it, then we can diagnose and treat. Okay, so imagine if we could not measure, for example, temperature. Okay, so if we do not measure temperature, we cannot tell how someone is feeling, perhaps in terms of having fever or not. But if we can measure temperature and we know whether it is high or low, then we can tell that this person is having fever, and then we put in place an intervention. So the same applies to mental health. If we want to treat it, we need to know how severe it is. We need to know the symptoms. We need to know how it is progressing, and this can be done through measurement. Then measurement also helps us to track the response to treatment and effectiveness of the interventions that we have put in place to treat these mental illnesses. Okay, so it helps us to know whether our interventions are working, whether at individual level but also in communities. So sometimes we might put in place interventions to mitigate these or prevent these mental illnesses in the community. So by measuring after some time and seeing whether our interventions are working, we are going to be doing this monitoring and evaluation. Okay. Then it also helps us in public health research, where we are able to tell the number of cases of mental illnesses that we are having in a particular place. We are able to tell the risk factors, okay, and also the trends in these mental health issues, okay. So all this is possible when we do measuring with the tools that we are going to be looking at briefly in this session, but also in detail within the subsequent sessions, okay. Then it is also important to measure so that we can allocate resources very well, okay. So when we measure, we can tell which area is having more mental illnesses, which mental illness is prevalent in this place in more numbers than the other mental illness, so that we can allocate resources effectively, we can allocate the drugs effectively, we can allocate the health workers effectively, okay. All right. Then so this measurement can be done using a lot of tools. We have these assessment methods that can help us to do that measurement, and one of them is called the clinical interviews, where in this case you have either a structured diagnostic interview or a semi-structured interview. So in this case, the health worker or person who is trained in mental health management will ask you questions which are closed-ended, okay. In the structured diagnostic interviews, there are closed-ended questions which are used, and then in the semi-structured interview, we have those open-ended questions and then the closed-ended questions. So, for example, a question like, did you feel like committing suicide in the last 1 year? And then I put answers yes and no. So that is already leading. It has only two options from which you choose from which you choose. So then so that will be closed ended. You already know that there are always predetermined answers. But an open ended question could be like, how did you feel in the last 1 year in terms of mental health? So that will leave you with freedom to write or to express yourself in terms of that question. So if I have the other closed-ended question and then an open-ended question in one questionnaire or in one interview, then it will be semi-structured. So that is what we are talking about here. So the clinical personnel or this personnel who is trained in mental health can utilize either the structured diagnostic interview or a semi-structured interview. Then we also have self-report measures. So in this case, the one who is interviewing or the one who wants to do this assessment might not be present, but they can send to you these questionnaires either through mail, physical mail, or online, and then you answer questions, and it's from these questions they are able to assess whether you are mentally ill or not, whether you're having a problem with your mental health or not, whether you are at risk of mental illness or not. Then there are also some rating systems in which you can put your details, and then this scale will tell you whether you are doing well or not. So these ones do not require a person, a mental health professional to be present, but you can do it yourself, and you get that assessment. So that is why it is called self-report measure. Then in the other assessment, we can have observational measures, and in this case, you can either do a clinical observation or a performance based measure. So the person who is trained in mental health will assess your behavior, your mood, or your thinking uh, functionality during interaction with this person. So if I am the person who is trained in mental health, I will make sure that I assess behavior, your mood, or your cognitive functioning while you are interacting with me. So if you come into the clinical room and I assess that behavior, that mood that you use in interaction with me on face to face, then I can tell whether you are doing well or not in terms of mental health. Then sometimes I'm as a professional who is trained in mental health, I can assign to you a task. Okay, for example, I can assign you a task to cook a meal for us. Okay, so in doing so, I want to see your social skills. I want to see your cognitive ability. So a task like cooking might involve you using the hands of other people. So if you do it alone, then I know that socially you might not be okay. So, and remember, we said that for us to deal with mental health illnesses, we need to make sure that we involve the social support system that we are having, the family, the friends, the people around us. Okay, so in performance based measures, we want to assess those cognitive abilities, those social skills, through giving you some of those tasks. Okay, so factors to consider when selecting the right assessment tool include the purpose of the assessment tool. Is it going to be used for diagnosis, for treatment, monitoring, for research, or screening? Because once you need it for diagnosis, for treatment, it needs to be as accurate as possible. Okay. If you're doing research, you might not be needing as much accuracy as the one of diagnosis, so you might use these self-report assessment tools. But when you're doing diagnosis, you need to use those clinical assessment tools. Okay, then in target, you also need to consider the target population. What age group are you focusing on? What is the average age of the target population that you're looking at? Because you might realize that different age groups can be assessed differently. Okay, the children, the middle age, the elderly have different characteristics that mandate or warrant different assessment tools. Then the cultural background, and then presenting concerns that require this assessment tool. We also look at factors like the setting, the time constraints, and resources available. So different assessment tools require different resources in terms of the personnel who is going to conduct this assessment. Does he or she have the right training or expertise to execute this assessment? But also the financial resource. Okay, how much money does it cost for you to run this assessment, okay? And do you have that money or not? Then the time constraints, do you have the time to do this assessment or not? So there are some assessments which will take you time and those which will be faster. So if you want your assessment results in a quick if you want your assessment results quickly, then you might want to use those assessment tools which will give you or which will not require you to spend a lot of time doing the assessment. Then the psychometric properties, reliability, validity, and sensitivity of the assessment tool. When we talk about reliability, we are saying that if I use the same assessment tool on the same person that you assessed, I should be able to get the same results, okay, over and over again. That is reliability. And validity, it should give me the exact measure that I want, okay. It should be accurate. It should be giving me exactly what I really require. It shouldn't give me wrong results. And then sensitivity, it should give me those true positives and not false positives. So it should tell the people who are mentally ill and not tell me that someone is mentally ill and yet they are not mentally ill. Okay, so that is sensitivity. So all those psychometric properties should be used, and we are going to be able to look at them in more detail when we look at these specific assessment tools later in detail. So there are examples of specific tools that we are going to focus on in detail in our subsequent sessions, and these include the patient health questionnaire, the generalized anxiety disorder, the social and emotional learning assessment or SEL. We have the World Health Organization Disability Assessment Schedule version 2. Many of them, okay? So that was basically about mental health. But remember, at the beginning of this session, we said we want to see how public health really integrates with mental health, so as to have public mental health. So public mental health refers to those collective efforts of society to promote mental health, to prevent mental illness, and provide mental health care services to all community members. We want to focus on promoting the idea of mental health. Everyone should have information about mental health. It shouldn't be it shouldn't be a topic that is not open for discussion, but everyone should be willing to discuss this about mental health. Everyone should be having information, and when they have information, then we can also prevent those mental illnesses. We can also create a community that does not stigmatize people who have mental illnesses. Okay, so it encompasses not just the individual diagnosis and treatment, but also the social determinants of mental health, like we had highlighted about them. We also have public education, advocacy, and then policy development, because if you want public mental health to thrive, then you need to put in place an enabling environment by having good policies, okay? Policies that support mental health to thrive, policies that can enable effective resource allocation to mental health. So then public mental health is a holistic approach. It addresses mental health at individual, community, and population levels, fostering that supportive and inclusive environment for mental well-being. Okay, so we have not arrived at that concept of public mental health out of the blue. There has been a historical journey because if you have watched those uh, documentaries of long ago, people who suffered mental illnesses in the early days of the 18th, the 19th century were always tied up and taken to places called institutions, and in these places they were left at the mercies of those people who manned them. Okay, those people would torture these people sometimes, and sometimes would end up killing them because they thought they were outcasts. They thought they were not supposed to be to deserve a normal life. Okay, so they were alienated from the general population. They were alienated from their communities. So uh, the 20th century came with a shift towards prevention of these mental health illnesses, public education, to empower the public with information about mental health, to demystify the concept of mental health, while people perceived it as something that was related to witchcraft, to a curse. Now, this 20th century shift was making came in to make sure that the public understands that these mental health the people who are suffering from mental illnesses can live a normal life if they are supported by the communities that they live in. Okay, then so that meant that we had to do deinstitutionalization. We had to do away with those institutions where people were shackled, were tied together, some tortured and killed because of having these mental illnesses. So we moved now towards community-based care, raising resource allocation and service delivery challenges. Okay, so in the present day, we focus on integrating mental health services, into primary care, so that at at those health service at those public health centers, at the lowest public health center, we have these mental health services. Even these community health workers should be having an idea of how to identify someone with a mental illness and maybe refer this person to the right place where they can receive uh, mental health care. Okay, then we also focus on cultural competence. Are the people are they having the right beliefs about mental health, or they are still stuck in those beliefs that mental illnesses are related to a curse or witchcraft? And then addressing the social determinants of mental health. Are we putting in place a social buffer? Can someone talk to you about how they are feeling in terms of their mental health, and then you do not judge them, you do not stigmatize them? Can they receive that social support from the family, the society around them? So that is the present day conversation that we are having in the public mental health sphere. So public mental health matters because it leads to improved overall public health, okay, by reducing the burden of mental illnesses. Then it is also important because it has an economic benefit. If a person is mentally ill, then they will not be productive. But if a person is mentally healthy, then we shall have increased productivity, we shall have reduced health costs, we shall have strengthening of the workforce, because we need a workforce which is mentally all right. And we can do this if we strengthen our public mental health services so as to mitigate those mental illnesses. Then we have social justice. When we have a good and robust mental health system, then everyone is sure that they are going to get services. Everyone is sure of this access to mental health care, not reserving it for perhaps the educated, the ones who have money. No, we need a public mental health service or system that can can operate with the principle of equity, where everyone can receive equal services, and that is why public mental health matters. Then empowered communities, through advocacy, through awareness creation, we can foster supportive environments by having communities that cannot stigmatize people with mental illnesses, but also promote resilience and mental well-being for all. So globally, we have 1 in 4 people in the world that experience mental health conditions every year. This is a very big number. 1 in 4 every year. Wow. And then we have depression as the leading cause of disability worldwide. Mental illness contributing 13% of the global disease burden. You can imagine that. For all the diseases that exist, mental health contributes 13% to that global disease burden. And then the way it also costs the global economy. Trillions and trillions are spent annually due to lost productivity, healthcare costs, and disability payments. And this disability being caused by mental illnesses. Okay, so when you think about this, you really should be intrigued and interested in knowing more about mental health. As a public health profession, how are you going to contribute to this struggle of having better mental health in your community, in your country, in Africa, and globally? Okay, because these numbers are not something that is good to look at. And the good thing is that when you invest resources, when you invest time in this, there is always a good return on investment. So, 4 to 1 return on investment is what we get when we invest in mental health care. Okay, so when you invest like 1 million, you're getting a return in investment of 4 million. Because remember, we've said with mental illness we have a workforce that is reduced. We have loss of productivity. We have a lot of expenditure on healthcare costs. So if we invest in preventing these mental illnesses, then we are going to recover all that economic expenditure. Then also we have the societal impact of mental disorders, because they lead to stigma, because they lead to discrimination and social isolation. Mental illnesses are of great impact to the society. Families and communities also bear that emotional and social burden from supporting individuals with mental illnesses, because there is still that gap of information, there is still that gap of social competence. Then some families which have these people who suffer from mental illnesses, they bear that emotion and social burden. They are constantly the laughing stock in the community. Okay, that is why as public health professionals we need to do more of sensitization. We need to do more of making sure that people get the right information about mental illnesses. Then they also contribute to increased crime rate. These people sometimes, if they are not handled well, they commit crimes such as defilement, theft, murder. These people who are having mental illnesses, then they are sometimes cast out of their homes and they end up homeless. Then because of crime rate, because of being a social nuisance, we always end up having social unrest. Okay, then the human cost on the individual themselves, we have suffering, because if you're having a mental illness, then there is that suffering, there is emotional distress, there is pain, there is loss of normal functioning. You can't function as the way you used to. Okay, then significant impact on the relationship with your family, with your spouse, with the community around you, at work, and overall quality of life is affected due to these mental health illnesses. And that is why we need to think about the strategies. We need to think about how we deal with these mental health illnesses. We have highlighted about some of these strategies, but we shall continue to mention many of them uh, that have been put forward so as to manage these mental illnesses and have better mental health in our communities. So also at the individual level, we have suicide. So if a mental illness is not managed well, or it is not managed at all, then there could be that unfortunate consequence of suicide where a person decides to take their own life. Okay, so ultimately we realize that investing in mental health care is not just a moral imperative, but also an economic and societal necessity. It is not a matter of doing what is right, but as we have realized, because of the societal and economic impact of mental illnesses, then when we invest in mental health, we achieve all those. We are able to protect the society, we are able to protect the economy, but also to do what is right. Okay, then we need so to do that, we need increased access to effective and affordable mental health services for all, and also to destigmatize mental illnesses and foster open communication, which is crucial for improved well-being. The society, the communities, the families that we live in need to know that mental illnesses are not just a thing of a curse. Okay, they are not out of witchcraft, and they need to know that they can be managed, and this person who is suffering from the same can live a normal life if they are supported well, if they are not stigmatized, and if they are not socially isolated. So that is it for today. A brief introduction of public mental health, and then in the subsequent sessions we shall be delving much more into these specific mental disorders or mental illnesses, and then the strategies to prevent them. So thank you for joining me, and I wish you the very best of the day. I'll catch you on the next one.